Hi. Very nice to meet you. I'm the pharmacist here. I will be administering the MMR vaccine for your daughter today. You can take a seat.
Thanks.
So do you have any questions before we get started?
So I'd like to talk to you about a couple of concerns that I'm having about the vaccine. After reading about it, I'm aware that there are some complications with the vaccine, so I was even considering not going ahead and doing the vaccine. So I was wondering if you could explain to me the benefits.
That's completely understandable, especially during the anti-vax movement, but I want you to be aware that there's nothing wrong with it. I think explaining it this way will help you better understand the benefits of getting the vaccine. The virus that causes the measles is the measles virus. It is an enveloped helical capsid with negative sense single-strand RNA. The outer envelope is made up of proteins, most notably hemagglutinin, that plays a role in the virus's attachment. The ssRNA has to be transcribed into a positive sense mRNA sequence. It can be translated into a viral protein. Cell-to-cell fusion occurs through dendritic cells in the alveolar spaces and ciliated epithelium, which transfers the virus throughout the body via the immune system. The virus exits the infected person through the respiratory tract. If an infected person sneezes or coughs, then anyone who breathes in the air or touches a surface and then touches their eyes, nose, or mouth may allow the virus to enter their body through the respiratory tract or the eyes. The incubation period takes place anywhere from 7 to 14 days after exposure. Early symptoms may include high fever, runny nose, eye irritation, muscle pain, and coughing. Late symptoms usually occur 2 to 3 days after the initial symptoms begin. These symptoms may include white lesions called Koplik spots that form in the mouth. Symptoms continue to develop 2 to 3 weeks after exposure. A rash on the skin begins on the face and spreads down the body. When these spots appear, the fever can reach as high as 105 degrees Fahrenheit. 1% of the cases of those infected with measles become fatal due to encephalitis or pneumonia. 1 case of encephalitis are reported in every 1,000 cases of measles. 10 out of every 100,000 patients who acquire the virus are subject to develop subacute sclerosing panencephalitis. SSPE fatally affects the nervous system and occurs 7 to 10 years after virus contraction. A sample is taken from the throat, nasopharyngeal, or urine, and then a positive serological test is performed to determine if the measles virus is present. The IgM antibody is measles-specific and confirms the presence of the virus. The test done for confirmation is a real-time polymerase chain reaction, also known as RT-PCR. There is currently no specific antiviral treatment that has been made available for a known measles infection. Preventative measures, however, including vaccinating and sanitary measures, such as washing your hands, can be taken to avoid contracting the virus. The vaccine for the measles virus is the MMR immunization, which protects against the 3 diseases, measles, mumps, and rubella. It is recommended to get 2 doses, one at 12 to 15 months and another at 4 to 6 years. So how does this explanation make you feel about administering the second round of the vaccination?
I'm still weary about having the second vaccination. Do you think maybe I could sleep on it and let you know?
Yeah, that is totally fine, but keep in mind that the virus is extremely infectious and there are no methods of treatment once it's contracted.
Okay, I understand. Thank you for your time.
Yeah, of course.
Appreciate it.
Have a great day.
Thanks.
I'm so excited for the first day of school. I'm Sky. What's your name?
I'm Caleb.
Can I have the blue?
Sure.
Thank you.
So what did you learn today at school?
I learned how to color.
Oh, cool.
Do you know what this word is?
Oh, it's upside down. It says sunlight.
Thank you.
Yeah. Did you meet any new friends?
Yeah, I met a kid named Caleb today, but he was coughing the whole time though.
Oh, make sure to be washing your hands real good.
mom in this video learned a very valuable lesson. Make sure to get vaccinated.